everyone and welcome to my channel. I am so excited because today I'm going to be sharing with you guys everything you guys need to know prior to your kidney transplant. I'm going to be reading the binder that I received from the hospital I got my kidney transplant from. This binder has all the information you guys need to know before to prepare you and also after. So it's gonna cover everything all the way from exercise to diet to even sexual activity after transplant. So I'm super excited because this is gonna inform you guys. And even while I was making this video, I was just learning so much and it really reminded me of a lot of the rules. And also guys, I wanna share with you guys which hospital I got my transplant from. I received my transplant at Unova Hospital. It's located in Northern Virginia. So this is their binder and I'm gonna be reading the information that's in here and it's super informative. I hope you guys like this video. Also, if you guys do, please don't forget to give it a thumbs up. I want to ask you guys to please subscribe to my channel for weekly videos, and also please don't forget to press that little bell icon so you guys can always be updated when I post a new video. Let's begin, guys. So here we have my binder. We're just going to open it up, and when you open it, the first page is the table of contents, which is basically an overview of how this binder is divided. First, we have general patient information, transplant clinic hours of operation, post-transplant instructions, post-transplant clinic follow-up, insurance information, ureteral stent removal, caring for your new kidney, home care, incision care, infection signs and symptoms, rejection signs and symptoms, nutrition, immunosuppressions, and food, activity following transplant, general health care information, support following transplant, medications, patient's record, transplant medications in hospital. And we are not going to go into every single section. We're just going to hit the important ones because not all of them will apply to you since transplant rules sometimes vary on hospital. So as you guys see me here, I'm just flipping through the pages and we're just going to go straight to the going home section. Okay, so we are going home and these are the rules that I was given. You will be asked to monitor the following. First, temperature. We ask that you take your temperatures 2 times per day before breakfast and dinner. Please record the results on your patient record sheet. B, also take your temperature anytime you feel chilled, hot, or achy. This may be the first signs of infection or rejection. C, please contact your transplant team for any temperature greater than 101.5 Fahrenheit. Now moving down to blood pressure. You will receive or be asked to purchase a blood pressure machine before you are discharged from the hospital. Your nurse will teach you and your family how to use the blood pressure machine. B, we ask that you take your blood pressure in the morning before breakfast and again in the evening before dinner. Please record the results on your patient record sheet. Hereafter, you have an average of what a normal blood pressure should look like. Now let's head over to the next page. Here we have weight. Please weigh yourself every morning after you urinate but before you eat and record the results on your patient record sheet. You should notify your transplant team for any weight gain greater than 3 pounds in the last 24 hours. Urine output. You will be asked to measure your urine output and your fluid intake amount and record the totals for the 24-hour period on your patient record sheet. It is extremely important to keep yourself well hydrated by drinking at least 2 liters, 2,000 ml of fluid every day. Please notify your transplant team for any decrease in urine output over a 24-hour period. A general guideline is that you should have at least 2 liters, 2,000 ml of urine output each 24-hour period. Blood sugar. This is for diabetes patients only. If you were diabetic before transplant or have recently developed diabetes since transplant, you will be asked to monitor your blood sugar. Please take your blood sugar before breakfast and before dinner. Record the results on your patient record sheet. You should notify the transplant team or your endocrinologist blood sugar doctor for blood sugar less than 80 or greater than 350. And before we continue, I want to quickly add that these steps are very important. You want to take this information back to your doctor as well as any other questions you guys might have. Okay, incision care. The abdominal incision is either stapled or glued. I would love to hear what you guys received. My incision was glued, so let me know in the comments down below which type of incision you guys had. The staples will be removed in 2 to 3 weeks after your surgery. You may shower after your transplant. Wash your incision with soap and water at least once a day. Please do not take a bath. After the shower, you should pat the incision area dry with a towel. You may have some drainage from the incision. Apply a clean dressing on it once a day to protect your clothes. If it is soiled, you may need to change your dressing up to every 4 hours. Observe your incision for any of the following: redness, swelling, discolored drainage, foul-smelling odor, incision separation. If you notice any of these signs, please call your transplant team. I personally didn't have to really follow these steps, I guess you could say, because mine was glued and it was super easy to maintain. I didn't have to do anything and it just looked perfect after like a week or so. Now heading to infection, and honestly guys, this might just be the most important topic. The first year of transplant, like I said, it's very difficult, and this is something you have to really be alert, be attentive, have that communication with your doctors, because you just never know what can happen. Now let's continue. Infections. You are taking medications to prevent rejection, immunosuppressants. These work by suppressing your immune system. This makes you less immune or more susceptible to infections. The first sign of infection is often fevers. Here are some other symptoms to look for and to report to your transplant team, nephrologist, or your primary care physician. Consistent cough, burning feeling when you urinate, diarrhea, vomiting, sores in your mouth, rash, or other skin changes. There are some simple things you can do to help prevent infection. Limit exposure to large crowds during your first 3 months post-transplant. Avoid contact with people who are sick. Wash your hands after using the bathroom and before every meal. Wash fresh fruits and vegetables before eating and cooking. Call if you are exposed to measles, mumps, chickenpox, hepatitis, or any serious infectious disease. Avoid changing cat litter and cleaning bird cages. Any infections with fever is worrisome and should be reported immediately to the transplant team, nephrologist, or any primary physician care. Because you are most likely to get an infection, you must call the transplant team before having dental work or surgery. You will need antibiotics. Now we are going to head over to rejection. And for me, this is a very important topic because it goes into detail all the way from exercise to your diet and so forth. Rejection. Rejection is the natural rejection of your body to something new or foreign. The white blood cells on your body recognize that the cells of the transplanted organ are different from yours. These white blood cells then increase in number and attack the cells of your transplanted organ. Complications will be serious if not treated. Rejection is often the biggest fear that transplant patients have. Most patients have a rejection episode. It's something that isn't expected. The risk for rejection is the highest during the first 3 months after transplant, but it can occur at any time, even years later. Fortunately, when you recognize early on, rejection is usually treatable. Not all rejections are preventable, but many are. The medications you take control, stop, or slow down the white blood cells attack on the new liver or kidney, so forth. These immunosuppressants work to keep you from rejecting. You must take your medications in the correct doses at the correct time. Missing even one dose increases your chance of rejection and losing your transplant. Signs of rejection: temperature of 101.5 Fahrenheit degrees or more, unusual fatigue or lack of energy/weakness, decreased urine output, increased weight gain, swelling and pain, tenderness on your organs, swelling on ankles or feet. Remember that the earliest signs of rejection is the change in the kidney/pancreas function, a rise in creatinine, a decreased urine output, a profound swelling. Keeping your clinic appointments and having routine lab work is very important. In addition to rejection, elevated lab results may indicate other problems. A kidney ultrasound and biopsy are often necessary to make a diagnosis. How to prevent rejection: take your medicines at the same time with the prescribed dose. Do not skip medication doses. treat any infections, avoid sunburn, clear any new medications you are placed on with the transplant team. Remember that you will probably notice a rejection episode from your lab results before you will experience any symptoms. As we continue, general health care. General health care after your transplant, you must have a primary care physician for your routine medical needs. You should complete physical every year by your primary care physician. All transplant patients should do a monthly breast and testicle exam. The transplant experience may affect your feeling and moods. Depression is common. If you need help coping with your feelings, discuss this with your transplant team. Nutrition. Eat a well-balanced diet. Smaller, more frequent meals may be necessary if there are feelings of fullness or nausea. Food may taste differently due to medications. Experiment with your spices and flavoring. No added salt diet is recommended for most people. Good nutrition is an important part of the recovery process. A common problem after transplant is weight gain. You feel so good and you have a healthy appetite. Plus, you will be able to enjoy food you were restricted to eat on dialysis. Moderation is the key to your eating habits after a transplant. We have a dietitian on staff to help you develop a specific individual nutrition plan if needed. Immunosuppressions and food. Prograf, cyclosporin, and prednisone can increase your blood sugar. Some individuals will become diabetic once they are on these medications. If you are already a diabetic on insulin, your insulin requirements will increase. If you are a diabetic on oral medication or a diet control, there is a good possibility you will require insulin after your transplant. If you have a strong family history or are overweight, you will also have an increased risk of developing diabetes after transplant. Symptoms of diabetes include an increase in thirst, increase in frequency of urination, blurred vision, and confusion. Please notify the transplant team immediately if you develop these symptoms. Prograf and cyclosporin can increase your potassium. Some individuals will be required to monitor their potassium intake. Some individuals will also require medication to keep their potassium normal. Prograf and cyclosporin can deplete your magnesium. Some individuals will require to take magnesium supplements after transplant. After transplant, you will have a normal kidney function and will no longer be restricted on your phosphorus intake. We'll be asking you to drink milk and eat dairy products to increase your phosphorus. Some individuals will require to take phosphorus supplements. Now here, it's just going to list foods that are high in potassium. You guys can pause this and read through it if you guys please, but we're going to continue to the next page. We are moving to exercise. This is very important. I get tons of questions asking about what they should do, what they shouldn't do. So, activity after transplant. Exercise. After transplant, it is recommended you participate in your regular exercise plan. Exercise can help control weight gain, decrease blood sugar, lower cholesterol, increase energy, improve digestion, improve sleep, reduce stress, and improve your self-esteem. As you can see, there are many excellent benefits to exercise. Exercise takes only a little time and commitment to healthy lifestyle. Walking is one of the best forms of exercise. Anyone can participate in this activity at no cost. We will encourage you to start exercising in the first 2 to 4 weeks post-transplant. Before starting to exercise, an individual should discuss with your transplant coordinator or physician. There are few restrictions after transplant. No lifting greater than 10 pounds for the first 4 to 6 weeks post-transplant. No sit-ups for the first 6 months post-transplant. Sit-ups can cause hernias in the incision. Started too early. Driving, returning to work/school. You will need to get permission from your transplant physician to return to work and driving. This will depend on your recovery. Length of recovery is individualized. The usual time for returning to work is 4 to 6 weeks. For driving, the usual time is 4 weeks. Sexual activity. Sexual activity is a normal part of a person's life. You can begin having sexual intercourse whenever you feel up to it. Most physicians suggest waiting 3 to 4 weeks. However, you know your body the best. Women. You should not become pregnant until after a year of your transplant and after consulting with your transplant physician. If you do become pregnant, notify the transplant team immediately since some of your medications can cause birth defects. Men may experience impotency due to the medications. If this occurs, please discuss this with your doctors. Acceptable forms of birth control: diaphragm, condoms, birth control pills. IUDs are not recommended because of risk of infections. High blood pressure. High blood pressure is a common problem after transplant. Some of the medications you can take cause an increase in blood pressure. An increase in weight can also cause an increased blood pressure. You will be monitoring and recording your blood pressure at home. These records will be reviewed in the transplant clinic. You may be required to take medications to keep your blood pressure under control. Skin and hair. Prednisone and other medications cause transplant recipients to have an increased risk for skin cancer. Avoid extensive exposure and wear sunscreen lotion of at least SPF 15 while outside. Remember, sunscreen wears off with swimming and sweat. You have to reapply lotion often. Prednisone could cause acne on your face, shoulders, chest, or back. If you develop acne, it is recommended you wash the affected area 3 times per day with mild cleanser. Dry skin can also become a problem with some transplant recipients. Use mild soap with body lotion after bathing. If you are taking prednisone, your skin will also not heal as quickly as it once did. Minor cuts and scrapes should be washed with soap and water daily. An antibiotic ointment may be applied with clean bandage. Report any redness, swelling, or drainage to your transplant team immediately. Prednisone can affect the condition of your hair. Perms, permanent hair dye, tints, and bleach make hair brittle and break off. Use a good conditioner and advise your hairdresser you are on medications that affect the condition of your hair. Alcohol. Do not drink alcohol beverages. Alcohol and some of your medications are broken down by the liver. Mixing alcohol and your medications can lead to liver damage. The medications that are broken down by your liver are cyclosporin and Prograf. Smoking. It has been determined by Surgeon General that smoking can be harmful to your health. It is recommended that you do not start to smoke after transplant. If you already smoke, it is strongly recommended that you stop smoking. Dental care. Regular and routine dental care is important. Before any dental procedure or cleaning, you need antibiotics, immunizations, and shots. The transplant team recommends a flu shot once a year. If you are traveling out the country and need a vaccine or pre-medications, please discuss this with your transplant team in advance and they can connect you with the infection disease physician. You are not allowed vaccination that contains live viruses, including the flu mist vaccine, shingles vaccine, and MMR. And our last point, it's support. Receiving a transplant can be stressful, overwhelming, so keeping yourself and your new organ is a lifetime commitment. And this is very important, and that's why you have the hospital, your team, also your family, and you have a Jesus, to help you guys and to support you guys no matter what you guys are going through, not just through your transplant journey, but also in life and all your everyday problems or your everyday encounters. And now I'm just going to flip through the pages. That's basically everything I wanted to go over. I wanted to hit the most important points. Here are just some pictures and examples of how the medication should look like and kind of like the common transplant medications that are given. And then you guys will see my daily records because you are going to be keeping track the first couple weeks of your transplant. This is very, very important. You guys will be doing this, taking your blood pressure, your temperature, and so forth.